Hi, this is Dr. Sayantan Chatterjee. I am an MD physician and today we will take a couple of minutes to discuss about stroke and cardiovascular mortality and morbidity in young adults. So who are young adults? Young adults are people or patients who are aged less than 50 years old. Traditionally, it has been perceived that stroke and cardiovascular mortality are seen in patients who are more than 50 years, but a recent study in 2023 has described patients who are less than 50 years to be approximately 10% of the newly incident stroke patients. Although the mortality among these patients is not that high, but the consequent morbidity associated with and the disability associated with the life of these patients have been seen to be on a rise. The risk factors that are most commonly seen are hypertension, patients with dyslipidemia. These patients have obesity, they have diabetes mellitus, they are smokers and have heart diseases. However, the traditional factors are there, but some additional factors or risk factors are also seen in young adults. These are migraine, patients who have shown symptoms of migraine such as headache or persistent headache, patients who take females who are on OC pills or oral contraceptive pills, pregnancy, recent history of pregnancy or postpartum state, also patients with patent foramen ovale and recreational drug use patients. Hence, a timely diagnosis of stroke is important to ensure a prompt treatment and reduce the morbidity as well as mortality. Hence, we see that atypical symptoms are most commonly seen clinically and they should be judged with a clinical cues. What are these atypical symptoms? When the patient comes, they might be complaining of headache. Worst headache of my life is a thing that patients usually complain of. Patients complain of nausea, dizziness that might be associated with these headaches. Also, the patient might have a history of recreational drug use and as well as use of alcohol as well as smoking. Hence, these patients should be correctly evaluated and diagnostic modalities such as CT scan, MRI, they should be used for proper and eventual diagnosis of the stroke or cardiovascular mortalities. Coming to prevention. So, the prevention can be done because this is a condition associated with lifestyle modifications. There are multiple modifiable risk factors which can be maintained, hence which can reduce the incidence of ischemic stroke or cardiovascular death. Therefore, a comprehensive multidisciplinary approach should be taken where the primary and secondary risk factors can be reduced. What are these approaches? Patients who are more than 30 years should undergo a checkup for their blood pressure, glycemic index, cholesterol levels, as well as they should be discouraged to have recreational drugs as well as smoking and alcohol use. So that is all that we had to discuss today about stroke, and we hope that there are better outcomes and people are able to prevent these diseases early in their life with lifestyle modification as well as early interventions by checking up and regular monitoring their blood pressure as well as glycemic index. Thank you. Namaste.